public health officials, lawmakers, and other experts are worried that the COVID-19 pandemic could worsen the country's already climbing suicide death rate. Prior to the pandemic, the suicide rate in the U.S. was at the highest level since World War II.
The CDC reports that from 2001 to 2017, the nation saw a 31% increase in the suicide rate.
And experts worry that the overall increase in suicide deaths, coupled with the current pandemic, are a perfect storm for it to get much worse. Some worrisome factors include economic stress, social isolation, reduced access to religious services, and increases in healthcare providers' suicides.
I just think that the mental health issues coming out of a crisis this profound are profound, and they will be long-lasting. And so we need to make sure that as we're looking at the healthcare piece of our response, mental health issues are front and center.
Some communities like Fresno and Seaside in California and Cook County in Illinois have already reported increases in suicide deaths during the pandemic.
There have been more suicides thus far this year in the Black community as in all of 2019.
But leading experts say it's difficult to draw major conclusions just yet. Data from the Centers for Disease Control and Prevention and many medical examiners' offices isn't expected for a while. But right now, Congress is taking some action. The House Energy and Commerce Committee has advanced 4 bills related to suicide prevention and education that are awaiting floor action. There's also a bipartisan bill from Senators Tim Kaine and Jack Reed, who are Democrats, and Bill Cassidy and Todd Young, that are Republicans, that would help address healthcare provider suicides. It's named after Lorna Breen, who is an emergency room physician lost to suicide earlier this year.
When you take someone like Lorna with her accomplishment, her lifelong desire, her family commitment to being healers, and you put them up against something that is just insurmountable. I mean, she just came up against something in coronavirus that was insurmountable.
There's also worry that some of these changes aren't happening fast enough. One of the bills would require the FCC to designate 988 as the National Suicide Prevention Hotline number.
The national hotline number, 988, no matter where you are in the country, if you're in the middle of a mental health crisis, you can get help. We've been working on this for 3 years.
But it would only have to take effect by 2022. There are things that can be done now, so experts recommend just increasing public awareness and education and what resources are already available.